Hello, everyone. Thank you for your patience. Welcome to this weekly update from Dr. Cara Christ on vaccine distribution in Arizona. A reminder, this session is on the record. You are welcome to record. We've been enabling you to record as you come in. If you're having any problems recording or need to be enabled, please ping me in the chat. And please raise your hand after the presentation if you'd like to ask a question. So first, Dr. Christ will have a presentation, and then we will take questions. Dr. Christ?
Thanks, Steve. Good afternoon, everybody, and thank you for joining us again today. I'm Dr. Cara Christ, the Director of the Arizona Department of Health Services. We have had a very exciting but busy week with the launch of the state's first 24/7 vaccination site out at State Farm Stadium. We wanted to give you an update of where we were on that project, as well as some other exciting vaccination projects, and talk a little bit about the data. As always, I will provide time at the end for questions. So I'd like to take you through some of our most recent data to point out what we're seeing here at Arizona. As you can see, the cases are currently elevated. We are seeing a large increase approximately 3 to 5 days after Christmas, as well as after New Year's. The week of Christmas, we had over 58,000 cases reported, and the week after New Year's, we had 62,000 cases reported each week. So you can see that that's a significant elevation. If you look at the day-by-day epi curve, you can see that it peaks approximately the 28th and 29th of December, and then again on the 4th and 5th of January. We've overlaid on our epi curve mitigation strategies and things that can or may have an impact on COVID-19. So you can see that we've added our vaccination. When vaccination began for phase 1A, you can see some of those holidays that have played a role in increasing the spread, as well as when our mitigation measures went into effect. So things that are still red or things that are still in place are in red on the epi curve and have not changed. I also wanted to share with you our percent positivity chart. So again, this is going to look slightly different than what is on our dashboard. Our dashboard has unique individuals who have had COVID tests. This has the total tests that have been run, including those repeat tests. So if you look at the dark gray bars on the chart, those will be unique patients who are being tested for the first time. And if you look at the gray, you can see that those are repeat Arizonans who are getting a number of tests. So the percent positivity over the last few weeks has been decreasing. Again, the week that we're currently in won't be finalized until Tuesday or Wednesday of next week, because we backfill to the date that that specimen was collected. So now I'll provide some updates on COVID-19 vaccine and implementation of our program here in Arizona. One of the exciting updates that we made today, this week, that is not reflected on our chart. It will not be reflected until Tuesday. But Arizona made the decision that Arizonans 65 years of age and older are now prioritized to be vaccinated against COVID-19 in our prioritized phase 1B, along with our education and childcare services and our protective services occupations, which includes law enforcement, corrections, and fire. This recommendation was approved by the Arizona Vaccine and Antiviral Prioritization Advisory Committee, which is intended to protect those who are most at risk for severe outcomes due to COVID-19. So we know that those that are over the age of 65 have a higher likelihood of hospitalization and death. And by getting people vaccinated in several weeks from now, we hope to reduce the strain on Arizona's hospitals. You can find additional information on our website at azhealth.gov/findvaccine. And on Tuesday, we will be updating that to provide clarity about which counties are going to be vaccinated the 65 to 74-year-old age group at their vaccination sites. We also have counties that have moved into our prioritized Phase 1B, and we have some that are fully in Phase 1B. So if you look at the map of Arizona, the counties that are in black are still in Phase 1A, so those are our healthcare providers and our long-term care facility residents and staff. When you look at our darker gray, that's the prioritized Phase 1B, so that's going to be the phase that we just talked about currently. We are vaccinating age 75 and older, along with educators and child care and their support staff and our protective services occupations. When we increase to 1B, that also includes our essential workers, and so those will be people that continue to keep our society functioning. That will be people who work in the transportation industry, including gas stations, shipping, those types of things, the food industry, including agriculture. So there's a large list of employees that are eligible for the 1B category that is located on our website. But you can find out what phase each county is in. And we update this infographic daily, and you can link to it off of azhealth.gov/findvaccine. As of today, over 232,000 doses of vaccine have been administered statewide. So now we'll move into Arizona's vaccine allocation and administration. Over the next few weeks, ADHS will be working to increase access to vaccine, increase the rate of vaccination, and to streamline communications. Vaccine distribution. Our local partners are the backbone of the vaccine program implementation and know their counties know their partners and their counties the best. So our federal partners every week provide our Arizona's allocation to the state. We divide that allocation up based on priorities to our local partners, who then will determine which then we place Arizona's full order for that week, and then the federal government will ship those orders directly to the providers that we will allocate our model, and providers such as pharmacies, community health centers, and physicians' offices will be able just to directly order vaccine from the manufacturers. Received additional first dose allocations of Pfizer, which were distributed again to Maricopa and Pima counties. All 15 counties received Moderna doses, and so we continue to reserve, given the unique storage requirements for our Pfizer vaccine. In addition to receiving those first doses of Pfizer and Moderna vaccine, we have received our second doses so that we can continue vaccinating those that have how much of each dose or how much of each manufacturer type we have received here in Arizona. So during the week of January 18th, Arizona will have been allocated across the state. You can see at the bottom where we have prioritized our CDC long-term care facility partnership by providing them with the vaccine that they need to vaccinate our staff and residents. Not all of these doses of the 803 for our county partners and will arrive next week. Of next week. So we continue to add additional sites for vaccine, 200 vaccination sites on our website. We also have activated so we initially prioritized in phase 1 of that partnership our skilled nursing facilities, which are our first visit from CVS or Walgreens, and they are scheduling appointments to start assisted living facilities throughout the state next week. So as additional state vaccine becomes available, we will be adding additional providers. We have a CDC pharmacy program to provide in-store vaccine partnership that CDC put together with our pharmacy partners. So our pharmacy partners go into the facilities and vaccinate the staff and residents of that facility. As of this week, over 140 skilled nursing facilities are starting next week. We've got over 2,000 facilities enrolled in the federal program. We're one of the states off over the next couple of months. So this is part of the infographic that we post each day on our website if you're administered, along with the vaccination rate per 100,000. And so you can see statewide, 232,000 tribal or federal partners, as this is pulled out of the state's immunization registry. So to talk about updates and announcements of this week, on Monday we had a soft launch of the State Farm Stadium COVID-19, averaging between 200 and 300 at 9 a.m. We're very excited because our partners have really made this endeavor possible. It's a whole community partnership. And again, we just want to thank the Department of Emergency and Military Affairs, the Arizona Cardinals and State Farm Stadium, Blue Cross Blue Shield of Arizona, the Catherine and at the site, and have made this possible. We also are very excited about the launch of our second state-run vaccination site. This will be located at Phoenix Municipal Stadium. We are still looking to see how many doses we will have available for that site. So the number of appointments will depend on the available vaccine. Again, we are partnering with the Arizona Department of Emergency and Military Affairs and Arizona State University to run this site. Arizona State University currently runs. Again, registrations for appointments are going to open up Tuesday, January 19th at 9 a.m. Vaccine website with an interactive map. You can go onto the map. It has all of the current locations with vaccine. You can select a site, and a box will pop up that has information about that site and a link to their registration. So not all providers are using their own appointment software, but we will link to them whenever we have that information so that it's one-stop shopping when you go to our map. We will continue to update this map with access. So ADHS activated the CDC Retail Pharmacy Program. This is going to add up to 100 pharmacy stores over the next few weeks. The first pharmacies to come on board in Arizona are going to be Fry's, Safeway, and Albertsons. And so those will be included on our sites as we get notified which specific pharmacy locations to go get vaccinated. When this program becomes fully activated, more than 800 pharmacies will have COVID-19 vaccine available in Arizona. We currently have more than 200 vaccination eligible, and you receive care at one of our community health centers. You can check on our website to see if they have received vaccine. And again, just an update on helping our Arizona hospitals. We have been recruiting nurses with a nursing staffing contract here in the state. That's been one of our most successful endeavors. We are very excited. The majority of the nurses are here. When they arrive, they will stay on. 8 nurses have started work. We anticipated almost 200 more arriving this week. Again, that we don't necessarily count them until we work with our staffing contract. Turn it over to any questions that you may have.
Cameron at ABC 15.
Hi, Cameron.
Earlier this week, health officials with Operation Warp Speed held a press conference. I reported on this press conference in it to states, specifically second doses they had been holding back, directly by General Perna of Operation Warp Speed, that the states will not. How does that affect your plan to expand our vaccine process here in Arizona? Directly from them about this.
So we have not been notified directly about Arizona's vaccine allocation or, potential not having the stockpile for that. We have heard the same things, other governors, talking about what they are getting notified of. My team, only all states, but especially. Now, that being said, that is our limitation, is that we are not getting as much vaccine as we would like to see in Arizona. We have made federal requests to get additional vaccine so that we can continue to vaccinate. But it's one of those things that we're working with our federal partners to ensure that we can keep our current vaccination sites and add those additional sites as planned.
My second question would be regarding the 65 and older. I've had county health leaders reach out to me who said they were not notified ahead of time from state leaders when this announcement was made, and it actually caught them off guard because they receive smaller supplies than larger counties like Maricopa County. They don't have enough to, their phone lines were flooded with people and their online sites were flooded with people disappointed that they couldn't get the vaccine at 65 and older. Do you regret how this was announced? Do you regret not having more communication with county leaders so they could prepare their populations for the inevitable news that to be able to expand to 65 and older?
So when we work with our county health departments, they are the boots on the ground, and they're the ones that are going to ultimately decide time. And other counties can stay in that sub-prioritized phase 1B. That just because we have approved for that to happen, it does not mean that the counties have to hurdle that all of us are facing. They don't need to move into that phase or allow all of those groups until they have the vaccine available.
Is there any part of this, this news about the lack of vaccine that disappoints you? Because obviously it feels like an overpromise from the federal health officials on this one.
So, planning on the vaccine that we currently get each week and making those prioritization decisions. So luckily it doesn't impact our current plans, but it is disappointing because we would have loved to be able to ramp up.
Very much.
Thanks, Cameron.
Next up, and I apologize if I mispronounced this, Cora Nylander.
Yeah, hello, Dr. Christ.
Hi.
I've heard from several folks. I'm down here in Pima County that have had issues registering for appointments on the online website. Our health department here has set up a phone number that was specifically supposed to be for mostly elderly folks to be able to register for appointments over the phone if they may not have access online. But if you call that number, it was supposed to be issues with that, getting very frustrated. Is there anything that your office can do to try and help mitigate those measures? So, specifically the elderly who all may not have internet or access to online means to be able to register to get their vaccines?
Yeah, I had not heard that was a current scene, especially in the prioritized groups. So we would recommend, continue the phone line, and we'll see how we can help Pima County. They're great partners.
And how do you go about, you mentioned how many different pharmacy entities are going to be handling vaccinations. How do you go about allocating how many?
So we activated the CDC pharmacy retail program. So basically what we do is we take a proportion of the doses off the top and assign them to the CDC retail pharmacy program. CDC then will allocate those doses to the providers that have stores. Because they are so busy vaccinating our long-term care and assisted living, they will be added in future weeks. So then, but we can also provide state doses of vaccine, things that have already been delivered to the state, but we want to get out to the pharmacy. And so then we can reallocate like 100 doses to pharmacies that have been allocated to the state as well.
And lastly here, what about folks that may be young, not elderly, but are immunocompromised, may be of a high risk, and they really want to get this vaccine as quick as they can? When can they expect to get a dose of the vaccine?
Another question that I realized I didn't answer. So the federal government this week made a recommendation that those over 65 should be included under 65 with a medical condition that put them at risk. Given our estimates of how many people that would include, we knew that the demand would be too great for the very limited those that are 65 and older. So we agreed to move them in, again, have the vaccine to accommodate that. We will continue to see when we can bring in that next group based on I can't hear you.
Bud is in the process of unmuting.
Oh, okay, good.
Unmuted right now. Pima County, when they opened their line yesterday, they had 20,000 appointments in the first couple of hours. So there's a huge demand for this. Everyone has been talking about ramping soon because of the news from the federal government that they have not been setting aside that second dose.
So that's one of the things that we have to find out information for. So what there's 6 later. What we've heard through the grapevine is that they don't have the stockpiles for that second dose ongoing, but that they believe that the manufacturing supply will be able to keep up with both first doses for you, but we will be working within our allocations to ensure that we are getting as many first doses as we can out, but also ensuring that people have access to those second doses.
Also, the CDC released a study today on, I don't know how to say this, B117, which is a variant, which they said is very highly transmissible, and is now appearing in the United States. And they said that they would have to ramp up vaccination and likely testing as well because of this variant.
So we are on the lookout for variant coronaviruses, and yeah, we had heard that they were starting to see a number of cases of this specific variant. I think that making sure that we have adequate testing and resources, and then trying to get as many Arizonans vaccinated. We are watching to see what those variants appear to impact the vaccine's effectiveness. But we know that viruses mutate all the time, and so it's always something that we're watching out for. And we have a great partnership with TGen and our university.
Final thing, it appears that hospitalizations have leveled off now, at least somewhat. We're a couple of weeks away from, might that have an effect on deaths down the road?
So we've seen a little bit of a leveling off over the past couple of days. It's promising, but we think it's a little bit early to consider that the ongoing trend. We know that hospitalizations tend to follow the cases by about 2 weeks. So, this would be about the time that we would start seeing hospitalizations from that peak. 10% positivity is promising. The leveling off of that is promising. We're seeing a couple of counties that are starting to see a downward trend in their cases. So all of that is promising, but it's very hard to predict if that's the path that's going to happen or if it's going to, go back up. So we'll keep posting the data so that everyone can see it and follow along with us.
Are you optimistic?
I'm hoping to be optimistic. I think, as we continue to get more and more people vaccinated, we won't see the immediate effects of a vaccination, but with all of our residents in our long-term care facilities, now maybe getting closer to their second dose, hopefully that will reduce the need for some of those residents, those high acuity people, to be transferred to the hospital.
Next up is Josh Sanders.
Hi, Josh.
Hi, Dr. Chris. Happy Friday.
Happy Friday.
He did confirm with Governor Kate Brown of Oregon that states will not be receiving increased shipments of the vaccine from the national stockpile next week because there is no supply. You said that, Governor Ducey has said that. How does this impact, though, us again going forward next week, especially when we're going to be open to the vaccine? And then I have a couple more questions.
Yeah, so yes, we do have more demand than supply, which in a public health standpoint, I want 100% of people vaccinated. So I am so excited that there is this much demand, because we weren't sure what we were going to get, how many people would want to get the vaccine. Now, as long as we continue to maintain those levels, we should be able to continue providing, the 24/7 at State Farm, at our Phoenix municipal site, and continue to get it out to the community and to the public. So there's several things that are in play. We've got that federal partnership that we're pulling doses off for our long-term care facilities. That takes a certain amount of dose added back into Arizona's total allocation. And we continue to work with our county partners to make sure that if they've got pod sites that they're planning or they've got events, to try and get them the vaccine that they need. We have not been basing our planning efforts on projections. And so really trying to stay within our means here so that everyone who has an appointment has a vaccine waiting for them. But it's difficult. I mean, we were hoping to see increased, numbers of doses. They are anticipating increase. We anticipate hundreds of millions of doses available by March or April. So I think all of that is promising, but we just go by our weekly allocation here in Arizona.
Can we talk about the relationship between ADHS and the counties? Maricopa County yesterday, Dr. Sunstein said that they will not be vaccinated. From listening to that press conference, it was clear that Maricopa County and the state are not on the same page. And the county, which represents 4 million of our 7 million Arizonans, what that is with the announcement of the Phoenix Municipal Stadium.
Yeah, absolutely. So we work very closely with our county partners. We make the recommendations from prioritize below that, and they have the opportunity to do that. We are just opening up the eligibility if there are counties that wanted to make sure that Arizonans have access, especially if they are high priority. But we completely understand, because the entire state is dealing with local where vaccine is not being utilized as efficiently, bringing it to places that are using it more efficiently, so that we can make sure that as many to look at that. And then the other question was the Phoenix Municipal Stadium. For a 24/7 site, we didn't know if people would want to be up at 3 a.m. getting their vaccine, but we were pleasantly surprised that all of our appointments through January booked. At the vaccine availability and making decisions about the priority, we do have a 24/7 spot in. Seeing that we had limited vaccine available, we wanted to make the most effective use of our sites and them to be a site that can be replicated in other areas. And so we're looking at where we can deploy that as well moving forward.
I wanted to ask, or I'm asking about the rate of distribution, because
Yeah.
so are we with the vaccine a very long time before we get anywhere close to herd immunity, and that is something that the governor has kind of stood on as this is going to be the end all, the fix all of it, which it's not, but the facts speak to that.
The rate of distribution, which is one of the reasons that we stood up the 20 sites. Maricopa County has extended some of their pods to continue administration of the vaccine, and we will continue to do that. We were excited yesterday because our goal at State Farm for this week, based on the number of doses we have, has been 6,000 doses per day. And yesterday, in a 24-hour period, we had over 7,100 doses, because like you said, we want to be making sure that those vaccinations are going into arms.
Absolutely, and that should be celebrated. My last question just centers around our most vulnerable when it comes to those older folks, 65 and older, 75 and older, because they can't navigate the computer, or being on a phone call. 211 will direct them to just say, hey, we don't have an appointment, call the number for ADHS. And I called it myself. I was on hold for over an hour before I had to hang up. And just talking to these older folks that are so frustrated, they may not even have somebody that can drive them to Glendale. What are we going to do for them? How are we going to fix that?
So those opportunities are going to continue to increase. We know that State Farm Stadium, I've been out there every day. For me, I live in the East Valley, so it's quite a distance to drive. So we completely understand. What we're trying to do is get more also into the community, so that people can go to their local pharmacy, they can go to their local community health center. Eventually, they'll be able to go as just trying to find your influenza shot. It's going to take a while given the limited resources for that. So what we would recommend, and we know that it is difficult to get an appointment or to use. One of the things that is available is if you've got somebody that's tech savvy and you don't have internet access, or you don't have, or you're just uncomfortable using that for registration, somebody else can register for you. You can get them started and just have them pick the appointment. That's not going to help right now because we are out of appointments, but more will open up on January. We've partnered with them to answer the calls. We have heard that there have been a huge number of calls, even more than we anticipated. And so what we're doing is we are getting another contract with a call phone and help get those appointments.
Thank you, Dr. Chris.
Thank you.
Okay, and just a note that Dr. Chris, we appreciate the questions. Dr. Chris' time is a little limited today, so if we're going to...
Hey, I feel like that was specifically geared toward me, so I don't ask you too many questions.
No. You're good. You're good.
I'm kidding. All right, so my first one...
Hold on, Matt.
You got me now?
You're back, sorry.
Yeah, you're back.
Okay, great. My first one might be the simplest one, just because I don't know what to tell people when they ask me. But for folks who made an appointment for the initial dose at State Farm, they're wondering when they make their second or when they get their next one. Does the state reach out to them? Do they do it right there on site? Can you explain that?
Yeah, absolutely. So what we're email from the department, from the same email that sent your confirmation and your registration, we are inviting those individuals to register for an appointment. We are holding blocks of appointments for those second doses. Those should be coming within the next day or two for first doses again. So you don't need to go back in to try and fight for an appointment. We are holding blocks of appointments for everyone who has already received a vaccine.
All right, my next one is, I asked you earlier this week a hypothetical question, and anecdotally, this is what we're hearing. We've gotten a few callers. Somebody will go to the vaccine site, they happen to be in a queue for supply, and how strict are we being about enforcing the 1A and the 1B? Or if we're not being strict, is the goal just to get as many shots out there as possible, but we're just not saying that? What have you heard?
Well, I think our overall goal is to get as many vaccine. And that's a decision that's made case by case by our clinical team. So if we've got the vaccine that's available and we've had a number of can receive that vaccine. And the things that go into that are, is this an individual of a care, are they a caretaker of the people in the car? If they are, and those people are over 75, the clinical staff may make a judgment call to vaccinate that person because that person still could put the other individuals at risk. Other things would be if they had an appointment but they weren't registered that day, they may do the vaccine at the same time if we have the staff and the vaccine. We're making those clinical judgments on a case-by-case basis to make sure that we're getting as many vaccines, that none are being wasted, and that we're trying to be as customer service friendly as possible.
Great, and my last one, I know other people have brought this up, I'm gonna bring it up one more time.
Yeah.
The disconnect there seems to be between the state and the county. You addressed some of the issues, you're gonna contract with another phone vendor because, we have heard that people can't get through. But this is what I'm sure all of the reporters on this call are hearing to a varying degree. And that's, there are elderly people who are calling us, some of them in tears. I live in Maricopa County. The county says 75 and older. The state says 65 and older. I don't know what website I went to. I don't know this, I don't know that. They just want to get their vaccine.
Right.
Would you agree that at least at the beginning of this rollout for our older population, it was not user-friendly? Maybe we had just rushed it a little bit.
So we have been trying to make sure that we have everything in place to try to accommodate the large numbers of people that are wanting to be vaccinated. We continually are improving. So was it Matt? Was it his recommendation?
Yeah.
Oh, so your recommendation coming back to us, because all of us agreed, why can't it just show, why do you have to go onto a day to see if there's available appointments? Why can't it just show that next available appointment? We thought that was a great idea, so we are implementing that to make it more user-friendly. We've been working with Google on making this product better. They're the initial developers of it. So yes, it has been a work in progress. We continue to improve. We do know that our counties really have the authority to make those decisions in their local jurisdictions for their communities. The governor was very emphatic that he wanted those over the age of 65 to be eligible and to be available when those counties were ready to vaccinate those individuals.
Thank you.
Okay, Ricky Vasquez, I'm unmuting you.
Hi, Ricky.
Hello. So still on the topic of registration, we've been getting a lot of calls from people that say, I'll drive anywhere in the state to get my vaccine. Pima County has their own registration, Maricopa, there's the state one. Are there any hurdles with people that are trying to just look for the next available and drive across the state to get it? And is there, will there be any issues with people doing say like a double registration, registering Pima County and Santa Cruz County to see which one sticks first.
So yeah, that definitely could happen. There's not one system that is going in, because if you figure when you're working with pharmacies and healthcare providers and community health centers, all of them are going to have their own appointment. It automatically reports and uploads the data to our immunization registry, which is great, but it's not a requirement to use. So yes, people may be able to go in and identify different appointments that may be available and make those appointments. What we would recommend, like our pods, you really need to look at what the requirements are for each individual location. We do have the registration link for those locations that are on our maps. But look at the requirements. At our pods, we would take anybody from any county if they're able to get an appointment.
And have you heard from any of the smaller counties of people coming from neighboring counties and using up more of their utilization than they were planning?
We have not heard specifically about that county to county. I know that there are always concerns that because we allocate on a pro population basis or a pro rata basis, that may if somebody lives closer to one county but they live in another, they may go over there. One of the concerns that we have heard, though, is that some of our bordering communities from other states, if they hear that there's a clinic in some of our border states, like along California, that some of those residents might come over. And so they've been planning how do they get that out to be more prioritized for Arizonans. The one thing that we would caution about that is the virus doesn't know what your state of residency is. And if you're in Arizona, whether or not you're an Arizonan, you're just as likely and at risk to get COVID-19 and to potentially have bad outcomes, and they will utilize an Arizona bed. So that's what we're trying to prevent and trying to make sure is that no one in Arizona gets COVID-19. We would like to see that end, but if they are here, they will be using Arizona resources, and so we just want to make sure that everyone's protected so that we can protect Arizonans.
Great, that's all I have. Thank you, Dr. Chris.
Thank you.
Next up is Katie Davis-Young.
Hi, Katie.
Hi there. I just wanted to clarify, Maricopa County says it's not opening up to the 65 plus group next week, but the State Farm and Phoenix Municipal Stadium, those new appointments coming online next week will be available to that age group?
Yes, so Maricopa County has 5 pods that they're partnering with some of our health systems to operate. All of the different sites have their, like, if you use the Arizona vaccine management sites, we have like requirements that you have to check, like, yes, I'm a healthcare worker, or no, so that we can screen to make sure that you fit one of the priorities. We will be opening ours up to age 65, but Maricopa County will be keeping theirs at 75 and above, given the vaccine doses that have been allocated to those specific pods. They just don't have the resources to be able to increase that age just yet.
Okay, and really quickly, can you talk about where the budget and staffing for the new Phoenix Municipal site is coming from?
Yeah, absolutely. So we received last week's an announcement that Arizona is going to be receiving $65 million. That's from that new package that was passed like a week or two ago. The time just all blurs together right now. But Arizona is getting $65 million specifically for vaccination efforts. And so that is going to pay for some of those big state-run pods. It's also going to provide funding to our county partners so that they can do their vaccination efforts. It's also going to go into things like a campaign to promote vaccine interest and to encourage people to get vaccinated. So there's a lot of activities that will come out of that, but that's where that funding is coming from. The staffing is coming from, we have contracts with ASU to provide the staffing and the resources and the logistics for those sites. We have that for State Farm. We're still working with ASU on what the Phoenix Municipal Stadium site will look like when it stands up on February 1st. We also are partnering with Blue Cross Blue Shield out at State Farm Stadium, who is arranging the volunteer efforts out at State Farm. And so we'll be working with entities to do that same thing. Some of it will be volunteers, some of it will be paid staffing. Oh, and I'm sorry, I forgot a huge partner. The Ben and Catherine Ivy Foundation gave us, donated $1 million to the department to help us with the staffing costs for the 24/7 site. So that's another resource that we were so lucky to get from our partners.
Dr. Chris. Okay. Next up is Mike Pelton. I'm unmuting you.
Hi, Mike.
Hi, Dr. Christ, how are you?
I'm good today. How are you?
I'm good. Two questions. I know time is of the essence here, both on current conditions in the state.
Yeah.
On mitigation, the state has not dialed up or implemented new measures, but according to the ADHS COVID dashboard, since last month, there's been, I think, 3 weeks and counting of more than 700 COVID deaths each week. So my question is, if 700 plus COVID deaths a week does not warrant new mitigation strategies, is there literally any scenario at this point that you would recommend or the state would impose new or more stringent measures?
So that's a really great question. I think one of the issues is, as we look around, a lot of the other states are experiencing the same thing. And when you look at the mitigation measures that have been put into place, my colleagues in California have, areas of California pretty locked down. That does not appear to be working in California. Florida doesn't have a lot of mitigation strategies in place. And so, all of the states are experiencing these same types of rises. Really what we need to do is to really enforce the mitigation strategies, because we have some significant mitigation strategies in place in Arizona. It's the enforcement that is really important to make sure that they're following the occupancy limits, the mask requirements. I know my team is out, and we go out on evenings and weekends to enforce some of those, enforce the requirements. But there's a lot of establishments that are there, and so, it's really more about enforcing the current mitigation measures because we know that they worked. And then really getting the message out about those small household gatherings. If you look at the data on like a day-by-day basis, if you look at our epi curve, the spikes on December 28th and 29th, so exactly 3 to 5 days after Christmas, and if you look at the spikes on January 4th, 5th, and 6th, they're very large. Most people are going to develop symptoms 3 to 5 days after their exposure to COVID. And so, we know that people got together during those holidays. And we're seeing that in the data. And what we would really encourage people is you can't let your guard down. Even when you're with people that you love, you have to wear your mask. You have to stay physically distanced. And we know that it's extremely difficult to do that.
Next up is Max Gordon.
Oh, okay. Hi.
Hey there. So what do you have to say to people who might be 75 or older, but haven't been able to schedule an appointment and are frustrated that the threshold has been lowered to 65 and older?
What we would say is keep working at getting that appointment. We will be opening up additional appointments. We know that when we looked at those that are 65 years of age and older, we know that that there is all of them are at a higher risk for hospitalization and death, and we knew that it would add approximately 750,000 Arizonans. We will continue to try to increase availability, but we do want to make sure that everyone who's at risk has access to the vaccine if it's possible. And we know that it's very frustrating, especially when the resources are so limited. We have been putting in multiple requests to our federal partners. I was on the phone with CDC yesterday saying, if there's states that don't want Pfizer, if there is states that aren't taking Pfizer and it's left, Arizona will take it. We have capacity now to increase the number of, appointments, the number of shots we're given. State Farm Stadium actually has the ability, while we're saying our goal right now is 6,000, that's because that's the resource limitation that we have. With our vaccine, we can easily expand to 12,000 a day. And so if we could get more vaccine, we would be able to even ramp up our administration more. So we continue to work on that front. but just to keep trying to get an appointment and to look at our website, because some pharmacies will have vaccine as early as next week, and they will have a number of doses that may not have as many people going for them given their geographical location.
Okay, next up is Haley.
Hi.
Hi there, Dr. Christ. So I just wanted to ask one question.
Yeah.
So the Arizona Department of Health Services has administered over 2,000 vaccinations per 100,000 people, as we know. According to the CDC's website, and as of this morning, Arizona is ranked 45th in the nation on a per capita basis for vaccine administration. So despite recent announcements, I just was wondering if you could give an answer on why that may be.
CDC says we've done 150K.
Oh, okay, so CDC sounds like they're a little bit behind in the data, so they're pulling data and they're only updating a couple of times a week. We would recommend going by our numbers on the website. Ours are gonna be closer to the real numbers. We know that we have a 24-hour reporting delay, and we know that if a site has dropped to paper, it may even be a little bit longer before they get that record into ACES, which is where we're pulling our data from. And so we even know, like, if you go look at it on Tuesday, it's going to be 5 days behind because they're not going to update on the federal holiday, and they update Monday, Wednesdays, and Fridays. So we would recommend using our site. One of the ones that we've been looking at is the Bloomberg tracker. They update on a daily basis as well. Sometimes they're a little bit behind our numbers, but they're pretty good about updating. And that shows, I think, today that we were 17th or 18th in the nation for the number of doses administered.
Okay, next up.
Okay, thank you for your time.
Thank you.
Allison Steinbach.
Hi, Allison.
Thank you so much for doing this. I appreciate it. So I have a couple questions, and I will try to ask them all at once, if that's okay to save time.
Okay, I might forget. Just remind me if I look blank.
So the first is that Biden said he wants to administer 100 million doses in his first 100 days. So I'm curious what impact you think those goals will have here in Arizona. So how would that sort of take place? Do you expect any more funds or staff from the federal level?
So we've heard that there's a potential, another bill that Biden would propose to provide more funding and more vaccine to states. We're very excited if that's going to occur, because we'll always be able to use additional funding and additional resources. We would be probably looking at administering 2%. Arizona's population is about 2% of the United States population, and so looking to get 2 million doses administered in 100 days, I would imagine. We always try to rise to the challenge, and so we'll continue to increase our vaccination to help him meet his goal.
And then my second question is in terms of homebound people. I saw that in Seattle, for example, the fire department is going door to door to sort of vaccinate those people who can't leave their home easily. I'm wondering if there will be any similar programs here.
So we're working with our local counties to identify their strategies. So we know that we've got some pharmacies that have more mobile pharmacy ability, and so working with them to get some of those homebound individuals, as well as, our fire departments have been community vaccinators for a long time. And so the counties may deploy those types of situations differently depending on the resources and the available the available vaccinators in their community.
Thanks so much.
Thank you.
Okay, next up is Martha.
Hi, Martha. Oh,
there you go.
Can you hear me now?
yeah, we can hear you now. Yeah.
Much. Dr. Chris, if you have not yet heard directly from federal officials that additional doses were not being released, how can you be certain that your regular allocation for here in Arizona won't be cut?
So we had heard that we were going to be getting a number of increased doses. We weren't actually given a number, but we were told to expect increased vaccine. What we have been told is that the current numbers, the baseline that we're getting right now, can be expected because that's the normal manufacturing rate that they're at right now. We can't guarantee that we won't get decreased vaccine coming up in several weeks, But we plan accordingly based on our allocations that we get. So we'll continue to monitor and adjust our appointments at State Farm to make sure that we have the available resources that we need as we get those doses.
And speaking of planning, does municipal stadium planning take into account that there perhaps may not be extra doses that will be released? And so how many appointments will then be available at that site when you start making them in just 4 days?
So that's what we're looking at right now. We'll be working over the weekend to determine what that potential allocation could be. We will likely start with fewer appointments and then potentially add more appointments if we identify that we have additional resources. But that is one thing that we're waiting on, is just to identify how many appointments we can get, because we don't know what the overall vaccine supply is.
Finally, can you just update us on the prisons in Arizona? Have they been receiving vaccines? Where are we at with the number of prisons and vaccines available to them?
So we are working with our correctional partners to get currently we are in prioritized phase 1B. So our protective services occupations, which includes correctional officers. I believe ADOA was working with one of the prison facilities today to vaccinate the correctional officers out there, and then any inmates that may qualify based on like high risk and stuff will be assessed in our later phase 1B. And so we have been working to ensure that they've got the vaccine allocation that they need in order to do that. And we're still onboarding additional prisons so that they can get the vaccine and have it administered.
Thank you for your time.
Thank you.
Adonis Albright.
Hi.
Hi, Doctor. Happy Friday.
Happy Friday.
Yeah, so my question is kind of similar. It's about the vaccination sites, the 24/7 sites. I've had some concerns that have been raised to me about the allocation for these sites and how it's going to affect distribution to other counties moving forward. Essentially, if they're all going to start to be funneled to these 24/7 sites. So my question is, how is the allocation working for these sites specifically? Is it just based off the allocation that Maricopa County is getting, or how are you guys handling that?
So what we're looking at, we are only using the Pfizer vaccine at our at State Farm Stadium and also for the Phoenix Municipal Stadium. And so the one nice thing about us using the Pfizer vaccine, because it has such stringent requirements for freezers and thawing and the time that it can be out, it can't see the sunlight for very long. Our rural counties actually asked not to get the Pfizer vaccine, so that saves the Moderna vaccine for our rural counties. We are not using Moderna at either of those sites. And so we're working with Maricopa County to ensure that their sites, and Pima County, to ensure that their sites that are utilizing Pfizer have the doses that they need in order to vaccinate their current, like their appointments that have already been made, and anything additional that they want to do moving forward. And then we look at the remaining Pfizer allocation to see what we can do at State Farm Stadium and at the Phoenix Municipal Stadium.
All right, copy that. Thank you.
Thank you.
Okay, next up is Patty in Tucson.
Hi, Patty.
Thank you for Hi there. Thank you for your time this afternoon. I'm also curious about what's coming into the counties, and I wondered, now that the counties have launched their rollouts, will you revisit having statewide sites so that more of that vaccine can get to the counties? Seems more prudent.
Yeah, so one of the things, we did get a little bit of increased Moderna this week, so we were able to give increased allocations to our counties. Pima County got more vaccine this week. And we're ensuring that they're getting the doses for their second doses as well. So we're working with Pima County on their plan to increase the number of sites and to increase the time that they are open and to give them the vaccine for them to be able to do their stated goals. So we're working with each county individually to make sure that they've got the vaccine that they need, and that that we're saving that very precious Moderna resource for the counties that have it, but we also do provide Maricopa County and Pima County with the Moderna vaccine as well. So we're really trying to make sure that the State Farm Stadium does not impact ongoing or planned operations.
Pima County was included in that on the Moderna? that they just wanted Moderna and not the Pfizer, or those
No.
the more rural counties?
Yeah, so the rural counties were the, no, that's okay. So the rural counties, the 13 rural counties, not including Maricopa and Pima, asked not to get Pfizer. Maricopa and Pima get both Pfizer and Moderna.
Okay, thank you.
Okay, and Director, I cut off Mike Pelton. He had a follow-up, so this is our last question.
We're sorry.
All right, hey, you got me, Dr. Christ?
Yeah.
And that might have been my fault. I think I got locked out. Might have been my fault for asking the second question.
Oh, I'm sorry.
I'm sure, for people who watch us every day, I think that there's a little bit of a disconnect, so I'm hoping you can clear this up. So
Yeah.
I assume you're aware that this week, top doctors at 5 hospital systems held a joint press conference, essentially saying their facilities are overwhelmed and urging additional mitigation efforts. So why is the state not listening to those doctors or doing any of the measures that these hospital systems are out there calling for, like a statewide mask mandate, closing indoor dining and the like?
So we're working very closely with our hospital partners to see what types of resources they need, provide technical assistance, make sure that they have the PPE and provide some of that additional staffing. So we have been working on that with them. I think while we understand that the hospitals are in the midst of a surge, and we are working through the Arizona Surge Line to make sure, that we are transferring patients as needed and coming up with ideas to help, get people who don't need to be in a healthcare or a hospital any longer into another type of setting, as well as looking at potentially bringing patients who maybe are lower acuity to other hospitals that may have capacity for lower acuity patients, but not those higher acuity patients. So we're brainstorming with our hospitals. One of the things that the hospitals don't really need to take into account is those long-term public health community impacts. So the impacts of what happens when somebody loses their job and can't get food, can't get housing, the mental health issues of that. And so we're trying to balance that from a public health perspective and make policy decisions that we believe will have an overall impact on the coronavirus transmission. And so we're working very closely. I meet with our hospitals every week. I meet with their intergovernmental relations people every other week. We are working with the governor's office to develop and establish policies that will be best for Arizonans.
Okay, everyone. Thank you for joining us today. Thank you, Dr. Christ.
Thank you.
And everyone have a safe and great weekend.
Yeah, have a wonderful weekend. Thank you.